Good afternoon. Welcome to day 481 at the weekly COVID update here at the EMA office. I'm joined with Mila from the Health Department today and Chairman Kern. Mila, you have the numbers for this week.
Thanks, Herb. Good afternoon, everybody. For July the 1st through the 7th, we have a total of 219 new positive tests out of a total of 2,839 for the reporting period. The age range of those individuals was 10 to in their 80s. The county positivity rate is at 7.7%, with the 7-day rolling average at a match of 7.7%. The regional positivity was 5.3 as of the 4th of July. Unfortunately, we have 5 new deaths to report today, individuals in the age range 30 to 90s with known and unknown health conditions, males and females. Countywide, we have conducted a total of 379,784 tests, consisting of 31,822 positives and 347,962 negatives. The total number of deaths to date is 484, and our condolences go out to those families. To date, the number of individuals who completed their 10-day isolation period is at 31,018. Statewide, we have conducted a total of 25,989,308 tests, consisting of 1,394,235 positives, and that's an increase of 2,496 since last week. Total deaths to date is at 23,278, which is an increase of 51. For St. Clair County hospitalization numbers, we have 11 patients hospitalized with COVID-like illness in St. Clair County, and regionally we're at 28. We have 0 patients on ventilators within the county, and regionally we're at 2. For congregate care, we have 1 new case to report at Integrity of Belleville. We continue to offer vaccine at 330 West Main, Monday through Friday from 10 to 6 and Saturday from 8 to 4. Testing is offered throughout the county. We have St. Clair Square Monday, Wednesday, Friday, and Saturday from 8 to 4, as well as MedExpress, CVS, Walgreens also offer testing. You can go to our website to find details or go to those individual provider websites as well. I saw an interview this morning that said a lot of the cases of COVID are now coming in with regular cold-like symptoms, emphasizing the reason that if you do have any type of symptom, we encourage you to get tested. We have a lot of those opportunities within our area. If you need additional assistance with registering or just general information, you can call the Health Department Monday through Friday from 8:30 to 3:30 at 825-4447. Chairman Kern?
Mila, do you need an appointment for 330 West Main, or you can still just come in?
You can drive up for Pfizer. Now, if you're looking for Moderna or J&J, you need to go to the site and register on the days that that's available.
Okay, but if somebody wants to go in, and what are the hours at 330 West Main?
Monday through Friday, it's 10 to 6, and on Saturday, it's from 8 to 4.
Okay. You know, I know you've noticed this. We had no deaths in June,
Right.
and we've already had 5 in July. So this new variant is really taking a hold, and we need to be ever cautious here in St. Clair County. And we're lucky to have Mike McManus here today from Memorial Hospital, the president, to talk to us. But before we get to that, let's take a look at the zip code reports and see the changes we've had since last week. They are substantial. In 62201, we're up 8 to 635. 62203, up 13 to 707. 62204, up 5 to 456. 62205, up 10 to 724. 62206, up 24 to 1,518. 62207, up 13 to 686. 62208, up 18 to 1,804. 62220, up 15 to 2,275. 62221, up 14 to 3,026. 62223, up 19 to 1,947. 62225, up 1 to 163. 62226, up 16 to 3,501. 62232, up 6 to 966. 62239, up 3 to 512. 62243, up 1 to 812. 62257, up 1 to 363. 62258, up 8 to 1,129. 62260, up 4 to 857. 62269, up 17 to 3,548. And finally, 62285 does go down 1 to 605. Regional positivity went way up this week to 5.3%. That is from last week's 3.7%, which was, again, an up number. So from 3.7 to 5.3 is not a great week on regional positivity. And the rolling average also went up from 5.5% last week to 7.7% this week. So, it's pretty clear that if people aren't vaccinated, they're a big part of the reason why we're seeing the spike here in the county, which we hope doesn't cause us to have to go backwards in opening, but it certainly leads one to think that something's going to have to be done to settle these numbers down. So we're lucky today. Mike McManus, who has been a partner with Team St. Clair, president of Memorial Hospital since day one, practically, 481 days ago. Mike, looks like we're kind of back, or headed back where we started, except if there is a vaccine now. So we have control over our destiny. All of us are vaccinated, and we certainly feel more confident, but what makes me feel less confident is how the variant is getting into the community. 5 deaths just this month. Let's talk a little bit. Tell me what you're seeing at Memorial.
Sure. Well, I appreciate being here, and first of all, I had hoped I wouldn't be coming back and doing this again, but here we are. And as you said, I'm just going to start. The number one preventive measure to prevent a resurgence, another surge, is vaccination. That's the number one thing we can do. As you know, as a county, we're not where we need to be in terms of our vaccination percentages. And so I just want to stress that, and we can't stress it enough. Every health system in the St. Louis, major health system, is mandating vaccination for their staff and their physicians, and they're doing it for the benefit of the patients and for their staff. And that's the number one preventive measure. But to your question, what we're seeing is just what you're reporting. We're seeing a absurd uptick. About 3 weeks ago, we had the first time in 16 months we had 0 COVID inpatients, 0. And for 5 days in a row, we had 0 COVID inpatients. And I have to tell you, it was a very emotional moment for our staff. There were tears. There were tears from our nursing staff about this because of what they've been through. And to think that we could see a resurgence, and to think that now today we have 8 patients. We have 8 patients. We had 0 a few weeks ago. I think you heard reported that in the county we have, or Milo reported, there was 10 or 12?
11.
11? Well, we have 8 of the 11 at Memorial. And we also got transfers from Southwest Missouri to our hospitals here at Memorial from Springfield, Missouri, because of what's happening down there.
So there are patients being transferred from
absolutely
Missouri
Absolutely.
to our hospitals here in Illinois,
Yes.
where they have very low vaccination rates
Yes.
in Missouri.
Yes, those counties down in Southwest Missouri have low vaccination rates, but to think that we could see a resurgence that is preventable, it is preventable. To think that we could see a resurgence and to have our staff go through what they've gone through the last 16 months is heartbreaking. Quite honestly, it's heartbreaking. And I think I'll even go further. I'll say I think it's disrespectful to healthcare workers to allow this to happen.
I agree.
Well, and I can't agree more, Mike. And as we all said, 481 days, and Team St. Clair, the people who have been out there following this, and people who have lost the loved ones, and now we're up to 484 deaths here in our county alone. And for the whole month of June, we didn't have any deaths, and to me that's alarming. I had a couple of the news media call me the last 24 hours wanting to know, what we thought about this. Well, what do we think about it? It's cautious. We've got to keep our guard up. We've been saying for several months now the light at the end of the tunnel was getting brighter, but now it's getting dim. And I don't want to say we're nowhere near where we were at, but if we don't convince these people who haven't been vaccinated out there to become a part of the solution, we're going to find ourselves going backwards. And these weekly updates that we've been doing, the last thing we want to do is to start going back to dailies. And I know a lot of the Team St. Clair members that they continue to follow us each and every week now, but I'm just concerned that we're traveling in the wrong way.
Mike, let's talk about when a patient is checked in for COVID, and we went over this for many days, but maybe people have forgotten. And I think the fact that those who are vaccinated get to go out, and kind of resume our lives, that those who weren't vaccinated think they can just kind of slip in and fill in and no one will know. But it's very intensive care when someone comes in with COVID, and very stressful for the healthcare workers.
It is, and a couple of things. First of all, you all know this, but the Delta variant is now the dominant COVID variant across the country. It's more than 50% of the cases nationwide. That's what's hammering the Southwest Missouri, is the Delta variant. And regionally, we're seeing an uptick. St. Louis had 90 cases reported daily. Just a few weeks ago, there were 20 cases. The fastest growing areas in Illinois along the Missouri border, like us. And so to give you an idea, we saw 95 COVID patients in the month of June. Now that's all settings, emergency department, inpatient, et cetera. 5 of them were vaccinated. The remaining 90 were unvaccinated. To give you an idea locally of the impact. And Southwest Missouri seeing younger people come down, being hospitalized, and down to, I think I read there was some newborns. There was at least one case down there. Now that's an exception, but to your point, it is a tough illness, and you read about long haulers, and you read about the lasting effects that we're just learning about. You read about the intense care that has to happen. Yes, that's all true. We were just starting to relax our visitation policies to allow visitation for COVID patients, which we never allowed before, but that requires the visitor to be escorted into the hospital, to don the PPE properly, to take it off, to be monitored as they're in the hospital, not to kind of go anywhere in the hospital, things like that. We're trying to relax our non-COVID visitor policies too. So this not only affects the patient, it affects the nursing staff, who then has to go through the stress they've went through for the last 16 months. It affects every one of our visitors. It requires us to still maintain some vigilance over who's allowed in the hospital. It affects a lot of things. And so to see that come back, like I said, is just really disappointing. Potentially come back.
So people need to get vaccinated
Yes.
is number one. Are there other things that, there is talk about asking people if they're in crowds to start to wear a mask again if they are vaccinated? Is that something that's being tossed about the medical community?
I believe St. Louis just announced in the last week that they're recommending indoor masking again and things like that. Do we really want to go back to that? Do we really want to have to go back to what we all went through when it can be avoided? To me, that just seems incomprehensible, truthfully. But that's what we're going to have to do, because it's back to the basics. It's back to hand washing. It's back to social distancing. It's back to masking. It's back to limitations of gatherings. It's back to all those things. It goes back to what we went through.
Because people who can get vaccinated, it's free. There are no barriers to it. There are certain people who
Yes.
who can't get vaccinated because of health concerns or religious concerns or age.
Sure.
But the vast number of people who aren't vaccinated can be vaccinated.
They can, and we have these conversations internally because, as I mentioned, we're not the only health system, but we're requiring vaccination. BJC health system wide, we're at about 75% of our folks are vaccinated, and so the other 25% is kind of where our focus is. We've been having some video town halls, online answering questions. You get a lot of questions, a lot of misinformation out there. We just had a specific town hall today about for folks of childbearing age, because there's a lot of information and misinformation out there about that. And really, it's interesting, because what it comes down to is, I believe that I'm a big believer in individual choice, individual freedom, but sometimes you have to make decisions that are in best interest of the common good, and that's where things get a little tough. And I think we're in one of these situations. And so, and humans just don't make decisions rationally. We all know that. Emotions come into it, our values, our past experiences, and things like that. So you would think we would take in the data, make an informed decision, and do what is the right course of action, but that's not how things work. And so you have to recognize that. And emotions and values impact the decisions we make. And fairness, autonomy, choice, all those things. So I guess my point is, at the end of the day, we can provide mountains of information to people that support vaccination is the right path, but it really comes down to that individual choice. And my plea today would be, make that choice for the benefit of those healthcare workers who really have been through the grind over the last 16, 18 months, because we can avoid having to prolong that for them. And please make that choice for that, if not for yourself.
And you led off with a statistic that I think we can't stress enough. Truly localized, the development of this vaccine was nothing short of amazing. Mm-hmm. That we have these 3 vaccines that are available. We have always been told that Pfizer, Moderna, 95% effective, and you brought a statistic in to say that of the 90 or so people, 95 people that came in, 5 had been vaccinated. All of the others have not been vaccinated.
That is true.
That stat really rolls in with what we're hearing
Absolutely.
nationally. So not only is this something that was predicted early on, that this would be the efficacy of that vaccine, but it's being proven right here in St. Clair County at Memorial Hospital.
That's our experience, yes. Absolutely.
No better evidence than the locals. It's not, I've always heard an expert is some guy from out of town. Well, this is a person who is in town, president of Memorial Hospital, giving us the numbers saying, get vaccinated. There's a reason. The reason is you won't get COVID, you won't end up in the hospital, mm-hmm. and you'll end up helping the community, because the community will be able to get through this so we can all get back to normal. We thought we were getting there, and then the variant popped up.
Yeah. And it's interesting because if folks have read or followed what's going on in Springfield, Missouri, and those 2 hospitals down there, you can sense and feel through their words the exasperation those hospitals are feeling down there. When I read about some of their comments and their press releases that come out, they are clearly frustrated and they're clearly demoralized.
Isn't there a certain amount of fear also that as people are unvaccinated and they're incubating this virus, that a new variant could be emerging, and one that may eventually punch through the vaccine that we all have?
I don't know. Honestly, I don't know. Who knows what the future would hold and what variants would emerge? But at least what I read is that the vaccinations are help against the current variants that are out there and reduce the severity of the illness. Okay. Avoid hospitalizations, for example, and our protection against these variants that have been coming out so far. So we do know that. I also see anecdotally, because people talk about, well, I've had COVID and I have antibodies and things like that. And the recommendation is, first of all, you don't know how long it's going to last, and the recommendation is to still get vaccinated even if you had COVID, because it is an extra measure of protection. And anecdotally, you're seeing evidence come out that the long haulers benefit from COVID vaccination too, by reducing some of those longer term impacts that they're having.
Are you seeing a number of patients come back in with long haul symptoms?
Our clinics are, yes. And we've talked about that within BJC. And actually, I'm glad you brought that up, because I would like to follow up and kind of see where we are with that. We talked about establishing sort of a centralized clinic for sort of the long haulers that we're seeing across the system, or is it better with each primary care office or things like that? But yes, we're seeing residual impacts, yes.
Well, I think the one thing, if you remember back when we talked about people were gambling way back months ago, and that's still what we're doing to a certain degree. There are people out there that don't want to get vaccinated because of all of these myths that we just talked about, some of them out there. But, 484 people aren't with us to make that choice.
Well, I agree. I kind of agree here, because I think if gambling terms, folks were making a bet, Okay, number one was, I might not get COVID, and number two, if I do, it won't be that severe. Well, I think the Delta variant sort of tilted those odds a little bit, didn't they?
Oh, yeah.
And in the House's favor, not in your favor.
No.
And so that bet maybe isn't the same kind of bet that you were looking at 6 or 9 months ago.
And my point to that is, though, how would you like it for those of you who are gambling, because that's what they're doing, and one of your loved ones end up getting in the hospital, ended up on that ventilator, and you know when that physician who has to come and break the word to you that your loved one is not with you anymore, and that could have possibly been avoided by getting them vaccinated or by you spreading that word, because that's what we need. We got to get the public, we got to get the children of the parents who maybe hasn't got vaccinated yet because they've read something that they didn't think it was a good thing to do. We've got to get that word out there, because I wouldn't want to be in that situation where my loved one was laying there and the doctor comes out and says, well, yeah, they're COVID tested with the variant. Well, yeah, I should have got mom or dad or grandma and grandpa vaccinated. I don't know why I didn't do that. That's a bad choice at that time. You can't do it. Now is the time to take that precautionary, get the vaccination. I mean, that's been proven to be a benefit.
As readily available as possible.
Yeah, it's not like there's this a scarce of it that we had there going on. Plenty of it. 330 West Main, they can go get it every day.
And I am a little worried as we head back into another fall and winter season. We were fortunate. We had very little flu last year because everyone was masked up. Everyone was social distancing. People were inside. That's not the case this time. So, if we get a normal flu season and we see kind of something come back, that's going to be a problem. That's going to be a problem.
Double whammy. Well, Chairman, it's good that you said, we've got this coalition, and not that we didn't like Mike.
We like Mike.
We like Mike, but he said hoped he didn't have to come back. But Mike, we appreciate all the work that you've done from day one with us. And like
Likewise.
I said, it would not break my heart if you never come back. We're still going to be friends. We're still going to talk.
Absolutely.
But it would be under other circumstances. But you've heard it from Mike right now at the hospital, what they're going through and what they don't want to go through. And I think he said it best. Think about those healthcare workers, the physicians, the nurses, everybody that works in that hospital. 16 months they went through living hell, basically. And we don't want to put them through that. And you can do your part by, if you haven't been vaccinated, get vaccinated. It's easily available. As we said, 330 West Main Street, right here in downtown Belleville. You heard Mila, the hours, and we'll make sure we get that out there. If anybody's got any questions, give the health department a call. Give us a call here at the EMA office. We'll put you in touch with the right people. If you've got any questions, if you've got any doubts, I'm sure Mike's got people at the hospital that can ease those questions, give you some good information on it. So that's what we need to do, because here we are at 481 days. We're bringing you this weekly update. We want to continue to do the weekly, and then we want to not be able to do them anymore at all. But until we get this thing going backwards again, we're going to be here with you every Wednesday. I hope it's not daily. If it turns into daily, you'll know right away. So, Chairman, I think, Mike, we may get a couple of the physicians to come back in over the next couple of weeks to kind of give us some updates. And like I said, we're in this. We said that from the get-go. We're going to be here because we all need to work together, and we're going to continue to do that here at Team St. Clair. So we'll be back next Wednesday. If anything happens in between now and then, we'll definitely put it on our site and let you know. So we'll see you next Wednesday. Everybody have a good day.